Welcome to Farmville, your #1 resource to pharmacotherapy. Today we will discuss obsessive-compulsive personality disorder, otherwise known as OCPD, a debilitating psychiatric illness that strikes approximately 1% of the population. Meet Peter, a 23-year-old accountant who has recently been convinced by his family to see a psychiatrist. He has been exhibiting signs and symptoms of what they believe to be OCPD.
Hi, Kimmy. Hi, Peter. I'm Dr. Sawyer.
Did you know that you're 5.63 minutes late? Am I gonna be charged for this?
No, you'll be billed exactly the same.
I mean, because it's gonna be like $19.53.
Well, so what brings you in today?
Well, Dr. Sawyer, clearly you can see my brother has some very peculiarities with what he's really particular about. So he's really particular about everything, from like the way he arranges everything on his desk, like his office supplies, up to the very last number on his Excel spreadsheets when he's working, because he's an accountant. He gets really focused on all these little things at work, or little details about like lists and things like that, where to the point where he's not even finishing his work on time. He's not meeting deadlines because he gets so wrapped up in these little things. He doesn't really have that many friends because he has this really stern, cold personality. He's very rigid. He always has to have everything exactly a certain way. And if anyone ever, like deviates from the rules and regulations, he gets really mad and worked up. And if he has a certain plan and someone tries to interrupt it, he starts having these panic attacks. So I'm just really concerned about him, and I feel like it's really interfering with his life, and he's not living the way a normal person should be.
I mean, I don't see what the problem is. I'm just very particular about certain things. I like to be neat, and everything has to be perfect. Everything has to be done a certain way. I mean, there are rules and regulations to everything. That's why they're there. I mean, Kimmy has been insisting that my obsession with being perfect is interfering with my social life and relationships and friendships and stuff. But I mean, I just feel that if people did everything my way and according to the rules and how things are supposed to be done, then nobody would have any problems with anything.
It sounds like you like to keep things very organized, very detailed, and very clean. When you go throughout your day, would you say that you have excessive thoughts that you are anxious about or you cannot get rid of?
Yeah, I mean, I try to stay really focused on a particular task. If I'm doing something, then it has to be done the right way. I mean, there's a certain way that everything has to be done. So if it's not done a particular way, then I'm gonna keep doing it until it's done. But I mean, if it can't, sometimes I get really frustrated if I can't do it a particular way, and I mean that's just what Kimmy is calling panic attacks.
Would you say that you check things excessively?
I mean, I check things enough so that I make sure that things are going the way they're supposed to be going, make sure that things are on track. And I mean, since I am an accountant and everything has to be on the dot to the penny, I think it's my responsibility to make sure that everything is correct and there are no errors. I would hate to find an error in one of my books. Guarantee you there isn't one. But, I just have to keep checking to make sure.
Do you feel the need to wash your hands frequently?
I mean, I wash my hands normally. I mean, there's just ways that you have to do things. It's after you go to the bathroom, before you eat, things just have to be set, rigid, in a certain particular way. You can't go to the bathroom and then not wash your hands.
Based on the information you provided, I'm going to diagnose you with something called obsessive-compulsive personality disorder, or OCPD. Now, I know it might sound overwhelming or scary, but we have a lot of ways that we can treat your situation. The first thing we'll do is have cognitive behavioral therapy, which you'll come in for a few times for some sessions to talk about your feelings, and we can monitor your progress. I'm also going to prescribe you an antidepressant that might help with your feelings of anxiety or loneliness. It's called sertraline, and I'm going to prescribe you 150 milligrams a day. I'm also going to prescribe you an anti-anxiety medication called alprazolam that you should take for your panic attacks. Do you have any questions for me?
I still don't see what's wrong with me. I mean, I'm just following the rules. What makes you think I have OCPD?
Well, people with OCPD are often characterized as anal retentive or perfectionist types. They are extremely occupied with details and rules and regulations, so much that they are caught up and it prevents them from finishing tasks at hand. Those with OCPD are usually very rigid and stubborn, and they allow for no flexibility in their lives. They're often very conscientious about their money and savings down to the last penny, as well as they tend to hold on to things even after their value has worn off. They have repetitive thoughts that they cannot get rid of, like you do. When something gets off schedule or unexpected risks occur in your day, they can experience anxiety or panic attacks, like you've described.
So how common is this disorder? Are there others like me?
And it's diagnosed twice as often in males as it is in females. Most people with OCPD are diagnosed in their early 20s, like you, Peter, so you're not alone, and most cases are similar to yours.
So do you know if there's any genetic links to OCPD and like family members who might get them too? Like, am I at risk to have it as well?
The exact causes of OCPD are unknown. Some studies have shown that there is a genetic link in OCPD, so Kimmy, your chances of developing OCPD may be higher than the general population, but it's highly likely that you will not develop it.
But I think you could use some structure to your daily routines.
He does this
Knowing
to me
how
all
you
the
are.
time. He does this to me all the time. This is part of the problem.
But
It doesn't
anyways.
always have to be your way.
Here are your prescriptions, and be sure to see my secretary on the way out so that you can make your next appointment.
Don't worry, I will. I'm gonna get that money back too.
Or you do that.
I will.
Thank you, Dr. Sawyer.
Have a good day.
You too.
I can't believe you made me come over for that. I mean, it's basically 4:55. I need to be at my bridge train, like right now.
Well, we need to
We
go to the
wasted-
pharmacy to get
you-
your drugs.
I hope that you can do this correctly, because there are certain ways to do this, and if you don't do this correctly, then I can't be taking this. But I have to be at my bridge train right now, okay? So you can do this by yourself.
Hello.
Hi, I'm Julia. I'll be your pharmacist today.
Nice to
Have a
meet
seat.
you. Thank you. Okay, Julia, I have these prescriptions for my brother.
Mm-hmm.
Maybe you could fill them for me, please?
Yes. Has your brother taken any of these prescriptions before?
No, this is the first time.
And do you know what he's taking the medications for?
He just got diagnosed today with OCPD.
Okay.
I believe, and so I think one of the medications is supposed to be for like his mood, because he has kind of a depressed, lonely mood these days, and then the other one I think is supposed to be for his panic attacks.
Okay. Okay. As you probably heard from the psychiatrist, OCPD is a personality disorder, and it's a type 2, axis 2 personality disorder,
Okay.
which is different than OCD, or obsessive compulsive disorder,
Oh,
which is an
really?
axis 1 disorder.
Oh.
Now let me look at these medications. Okay, so these are commonly used for OCPD. The sertraline that he was prescribed is a selective serotonin reuptake inhibitor, or an SSRI for short,
Okay.
and that will help elevate his mood. It can take up to a week to start working, but in most people it takes 4 to 6 weeks. So even if he may not feel the effects right away, he still needs to take the prescription every single day.
Okay.
If later on he doesn't feel like any effect is happening, he can, talk to his psychiatrist, and they can possibly change the medication or increase the dose or
Okay.
whatever she thinks is best.
Okay.
The most common side effects are dizziness, headache, nausea, vomiting, diarrhea, insomnia, and decrease in libido. However, since he's just starting this sertraline, I believe he should be taking a 50 milligram dose, not 150, Well, the 150 milligram dose is the target goal and is what he should be on to be effectively treated. He needs to be started at a lower dose in order to work up the medication in his system and prevent any serious side effects.
Okay, so that's written for 150 milligrams
Yes,
right now?
I'll go
Okay.
ahead and call the doctor to get that
Okay.
changed.
Okay, please do.
Okay. Now, this alprazolam, it looks like it's going to be used for the panic attack, like you said. And he should take 1 pill at the onset of a panic attack as needed up to 3 times a day.
Okay, 3 times.
So don't take it any more than 3 times a day.
Okay.
And he may experience drowsiness, sedation, memory impairment, and stomach upset.
Okay.
And if he drinks any alcohol while he's taking the medication, the drowsiness and sedation will be increased. So he should take caution while he's driving or operating any machinery.
Okay.
Now, do you have any other questions about the medications?
No, I don't think so. You explained everything really well.
Okay. Well, I hope your brother feels better soon.
Okay. Thank you, Julie.
You're welcome.